Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here at the station at 866-870-5752. That's 866-870-5752. Check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. And right now we're speaking with Dennis.
Dennis, Dr. Marc Darrow, let me just take 1 second before I answer some of your information that you asked about. The practice that I do is orthopedic medicine. It's called regenerative medicine, meaning we actually stimulate collagen, which is the constituent, it's the protein of the body, and we can help grow cartilage in the joints if we inject there. If we have tendinosis or ligament sprains or things like that, we can help that grow back also, and the whole idea is to end pain, to reduce or eliminate pain. I do it all over the body. I've been doing it for over 20 years, and it's been something that I've taught at UCLA for over 20 years, and the residents are now moving away from surgery and getting more into regeneration therapy or regenerative medicine. The things we use are platelets, which are cells in your blood. So we just do a blood draw, we spin it, and we inject that, and that stimulates tissue to grow. Or we can use stem cells from your body and inject that. So very easy, simple procedures. You walk into the office, you get some shots, and you leave. You don't have to have someone drive you. You can come in and drive home. It's not a big deal. So let's get back to Dennis. You've got discomfort in the upper thighs when you walk. You had x-rays done of your knees and your hips, and they look okay. Any other information, Dennis?
Well, it's more like a discomfort. I really wouldn't call it a pain. But I mean, I've had days where I could walk like 5 or 6 miles, come home, do 75 jumping jacks, and all of a sudden there's that discomfort. Not all the time, but fairly frequently.
All right. How old are you, Dennis?
68.
Okay. Do you think you might be overdoing it on certain days?
Could be, but I would overdo it before, but of course that's how it starts, I guess.
People always, when they come in to see me, one of the things I always hear is, I used to. You know, I used to do sports. I used to be 150 pounds. Now I'm 250. I get blah, 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 blah all day long of, I used to. So, doctor, why can't I now? Because things change. So I don't know the answer to what you're talking about, other than you do seem to do some excessive exercise, maybe not, for you. And you may want to tone it down a bit and see if you get this discomfort in your upper thighs anymore.
Well, upper and middle of the thighs.
Okay. What did your doctor tell you about it?
She referred me to a physical therapist, and it's a kind of a long story, but I went for 1 or 2 appointments, and then I stopped going, but I may go again. But doctor, would the be a possibility that it is the hamstrings?
If it's the back of your thighs, yeah. It could be a sprain. It could be where the hamstrings attach to the ischial tuberosity. That's the sit bones. It could be a lot of things. But, you know, to be honest with you, Dennis, like I say on every show, I've got to touch the area and move you around, do an examination to tell you what's going on.
Okay, it's not a serious problem. I'm not.
No, I get it, but at the same time, if you want to know what it is, I will have to see you. There's not enough information from what you're telling me at this point. If you want to come in, the phone number to the office is 800-300-9300. Yeah, 800-300-9300.
Could it just be a question of age? I'm sure it could.
Anything could be, but again, I have to examine you to see what's going on.
Right. Well, then
I mean, I'm going to be honest with you. I'm 72 years old, and I can't do the same gymnastics I used to do when I was 15. All right? I still get up on a high bar in the park, and I still do a few tricks, but I'm not doing the stuff I used to do. I'm still doing chin-ups with my feet up to my face. Yeah. You know, so I can get all my muscle groups in there. I'm still, doing a lot of push-ups and running and all those things. But can I do it the way I used to? No. Why can't I? If I did, I wouldn't be able to do it for a month again. And you may be in that situation. I don't know. I have to touch the area. Okay?
Yeah,
Make sense?
I have a hard time accepting certain things. That's my problem.
Join the human race.
Yeah.
Don't accept it. Do not accept it.
Yeah, don't accept it. Don't accept it. It's
go
fine.
see Dr. Darrow and see what he says, and
Yeah, it may be something we can fix.
Shape. I have the same weight that I did when I was 21. I eat a ton of carbs. I'm very lucky in that respect.
Yeah. Well, the carbs are no good for you no matter what you say.
Yeah, but they taste so good, though.
I know. You get a nice dopamine rush. It's a great drug. Dennis, God bless you. We're going to move on.
Thank
you
you
have
for your
a
call,
wonderful
Dennis.
day. Yeah.
And hope that you feel better soon. Our number is 866-870-5752 here in the studio. Give us a call. And let's go to Bryant in L.A.
Bryant, Dr. Marc Darrow, you've got right shoulder pain, I take it. How long has that been going on?
Well, the pain is not so bad. It's been going on. I had a bad accident the 28th of June, and there's limited motion is what I'm concerned about. I was talking about I couldn't reach the back of my neck. It's difficult to even reach like I can with the left hand. But
okay,
the idea is the process. The doctor mentioned something about taking out blood and spending the blood, and it rung a bell that I heard you say, so I figured you were the expert. So can you explain that process?
Sure, absolutely.
Because it's the same as yours.
Same, I wouldn't know. I don't know what any other person does. Everybody does it differently. I'm very comprehensive, and most doctors who do PRP in a shoulder inject one injection, and that's not going to do a great job because there are about 30 places in the shoulder that can be the pain generator, meaning the area that's causing your problem. Also, because you're losing range of motion, you may have what's called a capsulitis, or moving toward a frozen shoulder, so you have to be careful of that. We need to also do some home physical therapy for you. I mean, we teach you how to stretch it properly. I usually use something like a golf club and show people how to do that. Both of my shoulders at different times have been locked up completely, and I have injected them and stretched them back into feeling very good. I'm showing people who are watching this video right now that my shoulders are working great. So it's something that can be healed up. Be careful which doctor you do who's doing the PRP or stem cells. I've been told I do the most of anybody on the planet. I don't know if that's true, but I have a lot of experience. I've been doing it for about 22 years or so, and you're welcome to come visit if you like. If you like your doctor, use them and see how it goes. The number to my office, if you want to call up and get information, is 800-300-9300. You can also go to my website, which is www.lastemcells.com. There are videos there of me injecting shoulders and other parts of the body, and you can see if it's something that you think would work for you and that you want to do.
Yes, thank
All right,
you. But
Brian?
can I be a little specific about the process? He mentioned that they would spin the blood and take off a portion of it and put it. He didn't mention stem cell, but they would re-inject it into my shoulder.
There's different things you can inject that are proliferative, meaning they stimulate tissue to grow. Platelets are one of them. Stem cells are another one. And there's a bevy of other things, too, we used to use in the old days. Sugar water is good, not as good as these other things that are newer. Sodium moreuate has been used, but it's pretty painful. The zinc oxide is good. Zinc sulfate is good. There's a lot of things that can be done, but the modern things are platelets and stem cells, and they don't hurt the tissue, meaning you don't feel a lot.
Will the platelets work as well as the stem cells?
No. We use them in combination usually.
If it didn't work, then it would surgery be the next step.
Absolutely, yeah. You can start out with platelets, and then you can, if it doesn't do what you want, you can come back and either repeat the platelets or add stem cells to it. Yes.
Well, I'm
all right, Brian.
definitely against the surgery.
Well, nobody wants to have surgery, but sometimes it's necessary, but not usually with what you have. I would start getting on a program of stretching that shoulder so it doesn't lock up on you. That's the most important thing right now. So you can come in, I can show you how to do it. Okay. Brian, God bless you, man. We're going to move on and go to Helene and her knees.
All right. Helene in Burbank.
Helene, Dr. Marc Darrow, how are you today?
I'm well, thank you.
Tell me about your knees. How long have they bothered you?
Well, it's relatively recent, within the past year, and I'm one of those folks who I used to run long distance. I used to do high-powered aerobics, and the last 5 years I've been doing ballet bar, and all of a sudden both knees started having severe pain. And fast forward, I have had x-rays, MRI, particularly of the right knee, which is worse, but they're both really bad. And the orthopedist told me that I have a complete tear of the meniscus, completely off the bone, which he can't repair, but I'm not ready yet for partial knee replacements on both knees because I still have a lot of good cartilage. But Dr. Darrow, the pain is directly below the kneecap. I can feel it, and it's only when I go up and down stairs or get up and out of a chair. And it's severe in both knees. And if I lift the kneecap or support the kneecap, I can make the pain go away.
Okay. So it doesn't sound to me like you're talking about a meniscal tear that's causing the problem, okay? And people have a really hard time understanding this because, as a matter of fact, I just had someone come in the office yesterday, and they were telling me pretty much the same story as yours. And I moved the knee around and I said, you may have a meniscal tear, but it's not generating the pain you have. And they had the same thing where they had the patellar tendon that was red hot. So when I touched that, that's the part of the patella. The patella is the round bone in front of the knee that's closest to the foot. They literally screamed and said, don't touch that. That's really sore. And I said, just like I'm telling you, I mean, it's very serendipitous that I just had a patient come in yesterday with the same thing as you, it sounds like. And her doctor was the one that said, you absolutely have to have surgery immediately. Okay? I said, you don't need surgery for this. And platelets can probably help it, PRP, and maybe we'd have to add stem cells to it. We have to see how it goes. So don't get lost in these diagnoses that are made from MRIs or X-rays or whatever. I like to get the images to make sure I'm not missing something. But the meniscal problem typically is a problem when the knee gets caught, when it does, it starts to move and then it won't move anymore, or it's buckled. So that doesn't sound like your issue, and it sounds like we could help fix what you have pretty easily. And you would ask, well, what about that meniscal tear? And I'd say, who cares? You may have had that for 30 years, and it just never bothered you.
Oh, no, I absolutely
it's not bothering you now.
I believe you. And this came on so suddenly. And in ballet bar, you're up on your tiptoes, and you're doing a lot of bending of the knees. And it came on simultaneously bilaterally. And I believe that I do have a meniscal tear, and he's a wonderful orthopedist. But I'm desperate, and I really, really don't want to have two partial knee replacements. So I'm going to make the appointment.
Well, I have to just guess when I'm on the radio, and I'm guessing you do not need a surgery, and that surgery would make you worse. You don't want a big clump of meniscus being taken out. Then what's there?
No,
what's there
I don't.
To cushion the knee?
I don't want any surgery. You're absolutely right. So I'm willing to surrender and come in and see what you can do.
Well, it's not surrendering. It's just coming in and getting an examination, which will tell us in 2 seconds what's really going on and whether surgery is the answer or not. But from what you've told me, surgery doesn't even help what you have. Not a bit. It makes it worse.
Well, I completely am ready to try because I'm getting to that point, and I can't believe this is me, but when I come to a set of stairs, I groan out loud now. I used to run stairs just to keep in shape, and now I am deathly afraid of anybody that has stairs because of the pain of going up and down stairs. So,
well, I'd love to see you, Helene. Yeah, the phone number to the office is 800-300-9300. And I'd love to see what's going on. I'd love to save you from a surgery. That's the thing that I love about my work. Over the years, I see about 60 to 80 new patients a month now. And there are so many people that I save from surgery. It makes me feel real good about my life. And hopefully you're one of those people that we can avoid surgery with. And PRP, platelet-rich plasma. Go ahead. I'm listening.
Well, I'll make are they taking appointments today?
Absolutely. 800-300-9300. They're waiting for you.
Okay, great. Well, thank you so much for the advice. I sure do appreciate it.
God bless you, Helene.
Thank you, Helene. Appreciate your call. The number here in the studio to talk directly to Dr. Darrow is 866-870-5752. That's 866-870-5752. We have lines open for you, and we have time left. We didn't talk about the vampire facelift yet today.
Shall we?
Let's do it.
So it's a great name, which is the vampire facelift. It's non-surgical. That's the best thing about it. It's injecting platelets, stem cells, sometimes fillers with that, hyaluronic acid. And what it does is it regrows the collagen in the face. So it replumps it up like when you were young. And unfortunately, the body dries out. The collagen dries out as we age. And there's a very simple, quick, easy procedure. And by the next day, people are feeling good and looking good. So if you're interested in that, give us a call, 800-300-9300. These procedures are also done on the head for hair loss. Yes, we can actually stimulate the hair to regrow. It's not going to work on Dr. Phil, so if you're completely bald, don't expect your hair to grow back. If it's thinning, we can help you. And at the same time, what we typically do is check your hormones. There's a woman that I was giving hormone replacement to, and I talked to her yesterday. I got her labs in. She'd been cheating on the testosterone. And she was using very high doses of testosterone. And when I got the labs in, I said, your testosterone is super high. And she went, oh, my God, that's why my hair is falling out.
Oh.
So it's something that has to be done judiciously. It's not for everybody. It's got to be monitored. So a lot of times we have to actually lower the DHT, dihydrotestosterone, which can be done also. Sometimes people have very high levels of that, which can cause hair loss. So we have to be judicious, check the labs if we're going to do anything related to hair growth. And it's something that people love. And if you've lost your hormones, which happens sometimes in people, I've had people in their 20s lose their hormones because they're afraid of losing their hair, and they take DHT blockers like Propecia, and they end up having osteoporosis, thinning of the bone density. So medicine's complex. It is. You can't just do something simply. You've got to be checking a lot of different variables that involve what's going on for you.
Well, this is the thing, is we have old paradigms in place. We have old ideas, and it's slow for the new paradigms to come into vogue, isn't it?
It is, and doctors are turtles when it comes to medicine. What they learned in medical school is what's got to go on, and it's hard to wake them up. They don't want to take a chance. And unfortunately, fortunately, there is a lot of new medicine. The unfortunate part is most doctors won't look at it. Let's go to Rick. He's asking about his thyroid, and he may need surgery, and what's my advice. So, Rick, Dr. Marc Darrow, what's going on with your thyroid?
A couple of years ago, can you hear me clearly?
Not really. No, you're on a Bluetooth or something.
Let me get off of that. Real quick. Okay, can you hear me now?
Yeah, that's a lot better.
Yes?
Thank you so much.
Okay. 2 years ago, a friend of mine noticed a lump in my throat, and I went to go check it out. They gave me a ultrasound, and right away they took me to Kaiser, and a specialist told me, "Oh, you need to have surgery." Didn't want to do I forgot what they call it, where the
biopsy.
And I went to the surgeon. He said, "Well, you know what? At this point, it's not necessary, but if you want to take it out because there's a lump." I've been noticing off and on that the nodules shrink and they grow, but one nodule is at 3 inches and the other one I think is at 2. And I'm starting to have issues with swallowing, and sometimes my ears hurt like an ear infection, but I don't know if it's because I've gained a little more weight. But I talked to a cousin of mine who's a nurse, and she told me that it could be an issue with maybe I have something going on with my sinuses, because I do sneeze a lot.
I'm sorry, I didn't hear that word. Something to do with your what?
My sinus.
Your sinus.
The past, 10 years I've been sneezing a lot, and until I actually blow my nose, I stop sneezing. And the other issue that I need to check out is maybe it could be I have an allergy to a cat. Now, before I have the surgery, because she had the little seeds, the things that they got taken off, and now she's having an issue with her calcium. And of course, there's risk of surgery.
Parathyroid.
And, So I was wondering why sometimes my nodules shrink and they go back to the size. And I've also read this thing about this procedure where they inject something in your neck, your thyroid, and your white blood cells eventually absorb it. I don't know if you've heard of that, but it's been done in Europe, and it's now the FDA's approved it. So
I'm sorry I can't help you. If you want to go to the website and talk to me that way, you can go to www.lastemcells.com and email me this information. I'll get back to you. God bless you, man.
Thank you, Dr. Darrow. Thank you, Alex and Suzette, all the callers and those of you who participated. Grab a pen or a pencil, write down this information. Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.